Okay, Rose, come at any time. Welcome, 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 everybody in social media land. Welcome on to Medical Talk in Layman's Terms with Nurse Charlene. And tonight's topic, I wanted to keep on giving you what you need right now at the beginning of our new year's. This is my second podcast. Last week's was It's My Resolution, and I'm sticking to it. And I talked about resetting, budgeting, and different things like that, and getting your life together and stuff so that you have a chance. But I also did want to note that I said, when I said the resetting, that it's the whole month because you got a whole year of this and stuff. So just start sometime this month. Don't be so hard on yourself if you didn't start yet and stuff. And then those who did start, kudos to you and stuff, but that's all right. Those who want to start and stuff, let's just start even today, and everything, just a little bit, 1% and 1%, and you got this. So like I said, the topic tonight, just in case I didn't say it, is how to cope with an acute health crisis. That means your husband, your wife, your mother, your father, your grandmother, your grandfather, or whoever else, the kids, the dog, and everything and stuff. When you get into a acute means sudden health crisis, what do you do? How do you do it? So look at my board behind me and stuff. So y'all come on in and stuff. But my board behind me, it says it all and stuff. I'm in trouble. I never felt like this before, something close to that and stuff. That's my little people on this side. But look at that. Ambulance. You see how I'll be drawing. I'm telling you, I'll be getting good. I'm getting good and stuff. And that's a hospital bed with a little IV pole and a little person in there and a little window in the room. And then there's a wheelchair. Okay, I'm trying, y'all, and stuff. Don't judge me. But anyway, and then cell phone. Well, they don't have those anymore with the little antenna sticking up, and a home rotary phone, pick up hello, or whatever and stuff. But anyway, they all dialed 911. They always dialed the popo and stuff. So I'm saying all of that to say that this is my way of giving you a vivid imagination like I have, and stuff to do this. So before I get started, you guys and stuff, I want to read my podcast disclaimer so that I can make sure that I'm coming on here, but I'm staying in the standards. When I'm streaming live tonight and stuff, I'm also streaming on YouTube, and that is under Medical Talk in Layman's Terms with Nurse Charlene, and that's on YouTube. You got to type all that in to get me, but you'll be able to get old past lives and all of that stuff that you can go back and check out and everything. But also if you're I'm streaming live from Facebook, and that's where I get a lot of my people at and stuff, and that is under Charlene Nurse Allen, just as simple as that. And I'm also a business owner of several businesses, but the one that truly hits home for this podcast is called Your Body's a Snitch, Believe It, LLC and stuff. And so that really means something. That's a coin phrase that is going to take off. It already has, but it's going to take off and let you know, because you got to think about it. So I ran that across many disciplines and in the past, even as far as today and stuff, just letting them know what that is, and then they all think about it, because it does sound a little cliche, ghetto-ish and stuff, but no, it's getting to the point. Your body's a snitch. Believe it. Believe your body, because it's your body, and it sees stuff that you don't see on the outside. It sees the inside. It sees when that heart is not beating right. It sees when that mind is not working right. It sees when things are going, awry, and everything and stuff. So definitely that cliche, that's going to be the national anthem for us that want to learn about healthcare and learn about our how to help how to help our loved ones and everything else. Welcome on in, Rosie Granny Allen. It says she's watching and stuff. I appreciate you, my dear, and everything. I love that woman. She's making me the best doctor on the face of the earth. And anyway, let me go back to the podcast disclaimer real quick. The podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. Okay. If you have questions about a medical condition, reach out to a qualified healthcare professional. Okay. Never disregard professional advice or delay seeking it because of something you heard on a podcast. Guest views are their own and may not reflect the views of the host, which is me, or this podcast. The information shared is for general knowledge, just to get you your foot in the door and everything. It should not be used for any legal or medical purposes. Always consult with a licensed professional who knows your medical history for a meaningful evaluation. Stay informed, but always seek professional advice when it comes to your health. Always seek professional advice. The good thing is I am a healthcare professional, and I've been a registered nurse for 21 consecutive years now. And everything. This made my last year made my 21st year, so I'm going into the 22nd year and everything. So when I say this, I am a healthcare professional, but of course I can't be everybody's nurse or doctory girl or whatever and stuff like that. But that's fine and stuff. It's just at least you know to go on a podcast that's giving you, you know, something good instead of something weird, you know, and stuff. It's okay to get the weird and stuff. It's a part of life and everything, but getting all the information and stuff, because what I be talking about, I'm telling you, it's a matter of life and death. It's a matter of that emergency, your health, your strength. How do you take care of your loved ones and stuff? Everybody gets sick. Don't everybody get sick? Okay, maybe, you know, some of y'all, you know, never been sick a day in your life and stuff. And you better thank God for that, the good Lord for that. But if you have had the nerve to have something go wrong with you, just anything, it doesn't matter and stuff. Yeah, you would probably need something that pulls at your heartstring, that pulls at your consciousness and everything. Okay, I see the people's coming in and stuff. Miss Sandra, welcome on in. Sandra and T, welcome on in. And hello, Nurse Charlene and Rosie and Britt. T and I are here. Welcome on in, ladies and stuff. Thank you for coming on and everything. And Miss Brittany, she said, but you have. Okay, thank you. Welcome on in, Miss Brittany and stuff. Figure out what you're gonna say to me. But okay, baby, I love you. All right, and welcome on in, Pastor Carol. Thank you for coming on in and stuff, checking us out and everything. And you guys know if you have to leave for something or another and stuff, make sure that you catch the replay. It'll be available about 5 minutes after I'm off, you know, because sometimes I stay over a little bit late and you got somewhere to be and stuff. It's okay. It'll play, but I just won't be able to interact with you. Welcome on in, Nurse Mary. Bless your heart. Thank you and stuff. So tonight's topic is how to cope with an acute health crisis. Acute meaning suddenly, because it's medical talk in layman's terms with Nurse Charlene. So layman's meaning keeping it simple so that somebody who doesn't know anything about the healthcare, the jargon, the language we use can at least catch a nugget and maybe even save somebody's life, even if it's by accident and stuff. That's how we do it and stuff. Welcome on in, Miss Rosie Granny Allen said, praise the Lord, everybody. So let's go and get it done. Amen. Okay. Yes, ma'am. I'm gonna go and get it done and stuff. So of course I give you definitions and stuff. Let me know if you need a repeat on some of them, but this is how it goes. What is an acute health crisis? Well, the definition, I'm glad you asked, is an acute health crisis is a sudden, severe medical condition that requires immediate attention and can be life threatening or life altering. So anything that where you in trouble and stuff, you need to. It's a crisis. It's acute, and not meaning cute like pretty and stuff. It's acute like sudden. It's going down right now. It ain't waiting for next week when you got a couple days off. It's going down now, right now at this moment. That's what that is. Suddenly. Okay. So key features that I want to say that let you know that you're in a possible immediate or acute health crisis is it comes on suddenly. These are things that to look out for. This happens suddenly. Like I didn't even have time. I'm just dizzy, or whatever it is and stuff. I cut my finger off. I was just cutting up some potatoes and bam, it just my whole little tip is that it's sudden. You ain't ready for it. I wasn't ready. I always cut up potatoes. I always use this knife, whatever it might be. Okay. Often unexpected. You didn't expect to do that, but it happened. Okay. And stuff. It causes physical, emotional, or family stress. Grandma or mom or dad or you see what I'm saying? And then it may require an emergency room visit or 2 or 3 or you stay in after you go, or hospitalization, meaning that you go into the hospital and then they end up getting you a room. You're admitted now. So now it's a hospitalization or urgent treatment. They have urgent care clinics, but sometimes they can't handle you. So then they have to send you over to the emergency room. And usually the urgent care is right near the emergency room. You go there first. And if it's something simple where they could just prescribe you some medicine and everything and kick you out, they'll do so. Yes, they will. And stuff. But if it's something, this turned up and stuff, this was real medical stuff, she got to go to the ER, and stuff. And they'll send you on over to the ER. It's that serious. Okay. So that was features of what could be happening to make you go to the hospital, period, and stuff, or call 911. So now I want to give you the top 5 common acute healthcare crises for all ages. So it doesn't matter your age, this can happen to you. So I'm just going to give you the name, what it is, and why it's dangerous, if that makes sense. So, a heart attack. It's called myocardial infarction. Nobody's going to know that except for nurses and, people that might have heard it before or had one and everything, which is myo is the heart muscle. Cardio is the heart and stuff. So myocardial is the heart muscle. The heart is a muscle. So I'm trying to give you a little bit of medical terminology, and stuff. So that's why it's called that, or it's just called it's called a heart attack. And that's the best one I could explain. Miss Brittany said, let's go, nurse mom. Great job. I haven't started yet, Britt. Write that again in about 15 minutes. Okay. And stuff. But I love you, baby. And stuff. So a heart attack. And what is a heart attack? It's a blocked blood flow to the heart, meaning your heart, in order for it to beat and exist and do what it's supposed to do, it needs blood and the nutrients and some oxygen and all of that stuff, and it needs to be poured into the heart, and that's what helps the heart function. If it's too much, then it's a problem. If it's too little, it's a problem. Oh, Nurse Mary, she said some may call it a MI. So instead of saying myocardial infarction, they might just call it MI, which, is the same as myocardial infarction, which is basically a heart attack. If you had a heart attack before, you'll know what that means automatically just by default because you going through it. But if you never had a heart attack and it's somebody in your family and they had a heart attack, if they look at you and you looking like, what the heck is that and stuff, a heart attack, girl, a heart attack, boy, or something like that. So that's what that is and stuff. Thank you, Mary, and stuff. And so the reason why it's dangerous for blocked blood to your blood flow to your heart is because the heart muscle can die quickly. Your heart is a muscle. It's also one of your millions of organs that you got inside your body. And that muscle needs to always have blood flow because it's your pump, like your water pump for your car. It's your blood pump for your body. And your body needs blood to go up and go down, all the way to your pinky toe and all the way up to every part of your brain and everything else. Your eyes need blood. Everything in you needs some type of blood flow or access to blood and everything. So that's where that comes in. That's why it's dangerous, because if it's a blocked flow, that means that pump can't pump the blood where it's supposed to go because it's not getting what it needs. And that's the blood, something in the way, and stuff. So that's a problem. So the next one is a stroke. What is a stroke? I'm glad you asked. Blocked or bleeding blood vessel in the brain. So there's two different kinds of stroke. There's a bleeding stroke where it gives you too much blood and the blood go all the places it's not supposed to and drown your brain and stuff. And then there's one that blocks the blood flow and nutrients to your brain. And so that's a problem and everything and stuff. So in that case, the reason why it's dangerous is because brain damage can occur within minutes. So that's why you only got a few minutes to figure out what it is, and stuff. Usually it's going to present with certain things, like one side of your face kind of drooping or something like that. You might get blurry eyes. If nobody's around you, you might lose your coordination and stuff. It's going to show you. It's going to snitch because your body is a snitch. Believe it. Okay. So it's going to show you something. Okay. So that's a stroke. It's either oversupplying the blood and it's bleeding all over the place, drowning your brain pretty much and stuff, or it's not giving you the blood that your brain needs. It needs blood, and blood carries nutrients and oxygen and all the stuff it needs to function and fire well. When that is cut off, it's a problem. It's a problem. Okay. So then the next one, because I told you the top 5. So that was 2. The first one was a heart attack. The second one is a stroke. The third one, and these are the most common things that we'll come across and everything. The third one is a severe infection or something called sepsis. What is that? Okay, I'm glad you asked. Okay, so sepsis or a severe infection is an infection that's overwhelming the body. It's doing all types of stuff. It's so crazy. Mary said, time is so important, so go right away to the hospital. Absolutely. Everybody who waited, it'll be okay. I'm gonna just take some Tylenol and stuff. Maybe I'll take some Motrin and bleed out, and stuff. But you taking those things and stuff like that, and then bam, and stuff. There's nothing they can do for you. And then you find people that they waited too long. And so if it's a stroke, definitely, if it's a stroke, yes, Mary and stuff, because if you don't get to the hospital in time and you don't realize that your body is doing something that it's not supposed to, or if it doesn't feel right, check it out. Okay. If nothing else, if it doesn't feel right, check it out. Call somebody, ask them to look at you, or make sure that they know that they could call you to go see them. I did it for years for one of my neighbors, and stuff, that a elderly young lady and stuff, that I would go over there and check her out, and everything. And it was a few times, one time I said, you need to go to the hospital. And she was mad at me, but she went ahead and listened and stuff. And they went to the hospital. She had 2 broken ribs. But I was like, why is your skin already black? That means it happened hours ago, because your skin shouldn't turn. If it's a bruise that's black, if it's red or bright red or light red or something like that, that means it just happened. When it starts turning purple and all the other colors of the rainbow and stuff, that's a problem, and stuff. So she waited and stuff, hurting. And she had 2 fractured ribs, and stuff like that. And so had she not even allowed me, her conscience, ate at her and stuff. So that's why she went ahead and let me come over and stuff. And I checked her out and I was like, yep, you in trouble and stuff. But that could have been a worse outcome. What if it would have pierced her lung or something and collapsed her lung? It's so many things. But I'm glad that she trusted me enough that I did have to tell on her and everything. I had to snitch. Her body was snitching. I had to snitch on it. I didn't know what it was. I don't have an x-ray machine, but it was 2 fractured ribs. And I could just tell by what was happening. It was a black bruise. That means it happened a while ago, and then it turned that color and everything. So you see how that goes and stuff. Rosie Grandy Allen said, all right now. Will said, thank you, Mom, and stuff. So I did the stroke and stuff, and I did infections. And so the infection is overwhelming the body. So it's taking over all parts of the body. And the reason why infection or sepsis is dangerous is because it can lead to organ failure. Well, what's the organ? It ain't nothing but your heart is an organ, your brain is an organ, your skin, your entire skin system is an organ, your liver is the organ, your kidney is an organ, all of these, your lungs are an organ. Yeah, I'll catch it on. Okay. So yeah, that many organs. So if they start failing, not breathing means you're unalive, not alive, because no breathing, no alive. Your heart stop or fails to beat and stuff, that means you're not alive anymore. Yep, you're going, yeah, okay, and stuff. Just, I got to keep it lighthearted and stuff, but at the same time, make no mistake, this is a medical emergency, and that's why I'm talking about it. Okay, and so what else we got? Okay, number 4. So I talked about heart attack, stroke, severe infection or sepsis. How about a serious injury or trauma? What are those? Well, okay, I'm glad you asked. Falls. I've fallen and I can't get up. For an elderly person or even a young person, you can still fall and break your arm and stuff. I almost broke mine and stuff. I fell down some stairs because the stairs was wet and slippery. Boom, 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 boom. Down 8 stairs. Bam. That felt so good. But anyway, car accidents or head injuries. You fall and hit your head. Why is it so dangerous? You only fail. Everybody fall. Okay. Because why is it dangerous? Because of internal bleeding. Internal means in the inside where you can't see it. And it's bleeding, and stuff like that. So it's internal bleeding or a brain injury. You fall and hit your head and your brain is bleeding, or something like that, so that's a problem and everything. That's why it's so dangerous. And it's a medical emergency. You fell and hit your head, but it wasn't just hitting your head, but your brain got damaged from it and it started to bleed, and everything. But mind you, I said for all ages. So even a baby hitting their head on the floor, or something like that, that's a problem. Okay. All right. So then we got, last but not least, I talked about heart attack. I talked about stroke. I talked about severe infections or sepsis overwhelming the body. And then I talked about serious injury or trauma and why it's a problem. And then now I'm talking about acute mental health crisis. Y'all know that's a thing, that's a medical thing. If you go, let's go crazy. If you got a problem, you got a panic attack, you got PTSD, you got, schizophrenia, you got bipolar depression, you got, all these things going on and stuff, suicidal thoughts, and everything. That's called mental health. That's a part of the health, because if you succeed in messing up, then you succeed in dying, and everything. Welcome on in, Auntie Barbara. Hey, she said, hey, family, everybody, and stuff. Everybody, the family on here. That's right. And everything. So, acute mental health crisis. What is that? Oh, okay. I'm glad you asked. It's called suicidal thought. That's one mental health crisis and everything. And I don't know if anybody is aware of this except for medical people and people that go to the doctor a lot and stuff. They ask you, have you had thoughts of harming yourself? It's a questionnaire that they might give you at the beginning of your visit and stuff. Then they say, and if so, do you have a plan? Because most people, you might think of, I wish I was dead or something like that, but you don't really mean it. And then you got somebody say, I wish I was dead, and I wonder if I should take pills or should I just drink a whole bunch of alcohol and then get in my car and just ram into something and kill myself. Or yeah, that's a plan. You might succeed and be unalive. You see what I'm saying? So that's why it's very important, not only to have the thought, because everybody didn't had a thought and felt, oh my God, or something like that. But then there's also when you take it a step further and then it turns into something like having a plan for it. Okay, I know how to do it. I'm gonna give myself this and I'm out. I'm gonna take this many pills. I know they can't get to me in time, and stuff. That's a plan. I'm gonna jump off the bridge, and then you make it to the bridge, and you on the side where you can jump off. You're not surviving that. Most likely, you're not surviving. You get on the Golden Gate or the Bay Bridge, or so. Yeah, I've yet to know anybody that survived that and everything. But I'm saying that's a plan. Somebody thought that out meticulously, and then they got over there and got to that spot, and everything. So that's one. But also psychosis. That's just the act of being in a trance, like, and stuff. You're in something, like if it's severe depression, no matter what it is and stuff, and you can't even bring yourself out without help and everything. And then there's a panic attacks. That's actually a mental health problem. A panic attack is when you're sitting here looking just like me and you're going 100 miles per hour. You scared, you it's after you impending doom, and your heart is beating out your chest, and you don't even know why, exactly, and stuff like that and stuff. So that's a thing. That's terrible, and stuff. And it's definitely something dangerous. And why is it dangerous? Because it puts you at risk of self-harm. That's the jumping off the bridge or taking a bunch of pills or drinking and driving and taking somebody out with you, or whatever and stuff. Or psychosis would be the inability to function safely. That would be a panic attack too. Like you can't, I'll be transparent. I had a panic attack at work, and I knew that I didn't feel right. But this was before your body is a snitch, believe it. This is my true story and stuff, where I don't know what exactly, I can't even remember what brought it on, but I remember having the panic attack. But I was like, I think something wrong with me. I couldn't catch my breath. So I'm a nurse at a hospital. So what they do, all the nurses come and look at me like, what the heck is wrong with this heifer and stuff. And yep, it was something wrong with me. And I spoke up instead of trying to do something and then I mess up and I put people's life at risk and stuff. So the first thing they did was told me sit down. Somebody went and got me some water and stuff, and then the other nurse came with the little blood pressure machine and took my blood pressure. It was like and I didn't normally have high blood pressure or anything and stuff. They took my blood pressure. It was like 160 something, but it was three numbers. It was 160 something over like 105. So I knew I was in some type of crisis. My blood pressure ain't never like that and stuff. So yep, I'm thinking about something I'm not supposed to or something, and stuff. I didn't exactly fully understand what I was going through and stuff, but my heart rate was really high. It was like 110 or 115 or something like that. So it was clearly that I had something wrong. I messed around and found out something that I didn't need to be there, or whatever and stuff. So okay. Oh, okay, Charlene, we just gonna replace you and stuff. You gonna have to go down. I'll wheel you down to the ER, to get checked out and everything. So that was fine. But in the meantime, I'm sitting up there like I drove my car and stuff. So I knew something was wrong, and it started before I even left my house. It must have happened on the way and stuff. So I'm driving and stuff. I make it all the way into the parking lot. I park across like diagonal in the wrong way across the lines and stuff. So my car would have been towed also. So I should have known that I didn't do something right. But remember, I'm on here telling you because I've been through some of this stuff. If you see yourself or find yourself in this situation and stuff, please know that you need to tell on yourself, and stuff. I'm a nurse, so I shouldn't have to do that. I know what's wrong with me. I can guess what my blood pressure is. Yep, I couldn't guess. That's not true. And actually, because nurses are actually human beings too, yeah, they can find out too. Everything that they take care of the patient with, they can get too. And everything. So I'm saying all of this to say that it doesn't matter what your occupation is. A doctor can have a panic attack. A doctor can get pneumonia, COVID, and anything else that anybody else can get. All the other little ones out there, and everything that we call people and stuff. So the moral of the story is anybody can get it at any time and have a healthcare crisis. Okay. So then let's go ahead to why is it dangerous? The risk of self-harm, the inability to function safe. So guess what? I probably shouldn't be driving that Cricket car that I found out later that it was Cricket, and stuff. So they gave me the medicine I needed and stuff. And then I was able to call somebody to come pick me up and drive my car home and everything and stuff, which thank you, family. But at the same time, that happened. It still happened to me. So am I going to forget? That happened probably about 6 or 7 years ago, but I never forgot. Just in case I ever caught up with another one or something like that, I need to be ready and everything. My body was snitching. Okay. So another thing is because the topic tonight is how to cope with an acute health crisis, meaning a sudden health dilemma, problem, really problem, not dilemma, problem and everything. So risk by age group. For children and teenagers, so that will be your children all the way up to the age of 17, I'll give it. And that's they can suffer from an asthma attack. How many kids are in the hospital with asthma attacks? It's like if you got 3 children, 2 of them might suffer from some type of asthma attack or some type of asthma. A lot of kids grow out of it and stuff, but that still don't stop it from being scary when they can't catch their breath and their little airways close down on them, because no breathing means not alive, and stuff. So if they can't even get the air in, could you imagine they're suffocating slowly and they don't understand? So they're gonna cry and cough and try to pull it in any way they can, but they babies and everything. So so one is asthma attack. I said children to teens. The second one would be a severe infection. Like they get infections also, meningitis and different things like that. Maybe not so harsh, but infection can mean just inflammation, bacterial infection of their lungs or something like that and stuff. But they're all things that they can get. Infection, they could cut themselves outside and then it doesn't heal, and stuff like that. And so that's an infection. So it's a problem. It's a problem, period. And then it gets painful and everything when it's inflamed. It gets painful. It swells and all of that stuff. So it's all those things. Accidental injuries like falling off the monkey bars, and stuff, or being pushed on some type of go-kart or something like that and flipping over it and skidding up the face or something. That's a problem. They hit their head, and stuff like that. So even kids get into acute health crises, and stuff. So you see where I'm going with this. So then there's also mental health for the children, and stuff. Even though they're children, they go through the drama like the adults do, and stuff. What makes them different? It's a whole bunch of little kids in different households and they're brought up differently and stuff. You don't know what's going on and stuff. They could be bullied. They can have body image problems. Somebody got their little titas, the young girls, they got their little booby boobs before the other ones. And the other one, I'm sitting up here flat chested, and I want some boom booms up there, like I don't know what they do, but I'll take a couple. Oh, I can't have none yet. Or, you just never know what it is. Or, the young boys and stuff, some skinny as a rail, no muscle factor, and stuff like that. And then they got they friend the same age as them, and you all thick and bulked up and stuff, look like he been on steroids and stuff. And they looking good, and we kids, ain't nobody gonna mess with him. He all buff and stuff. They gonna mess with my straggly little Harry Potter looking self, or something like that. So that's what I'm talking about. So they have drama, and that's body image for the girls or boys, and stuff like that. And the same thing with other things for the boys and everything. So then you got your young adults, 18 to about 40 years of age. So they consider that young adults. That's about right. That sounds about right. And they get into traumas like accidents, car accidents. A lot of times, motor vehicle, you turned up, you got your little ride and stuff. You ride with your friends and stuff. You want to go crazy on the freeway and zigzag, and somebody didn't get the memo and they run into you, or you run into them, or and so I'm just saying, I'm making up stuff, you guys, but I'm just saying, car accidents, or violence, and stuff. It's, all of this stuff going on and stuff. They don't fight anymore and stuff. They jump you and then you be in the hospital with your skull getting cut open or something, or they shoot at you, and stuff like that. So the girls shoot, the boys shoot, and stuff. Young adults shoot, and stuff like that, or stab or whatever they can. So it's serious. This is today's action. What we doing? We all stressed out. The kids stressed out, the young adults stressed out, and guess what's next? Middle age. I'm not middle age. I'm a leap year, so I'm not middle age and stuff. But for those of you that are middle age, that would be 41 to 65 and stuff. You got a lot more to worry about. Because guess what? Middle age 41 to 65, you're definitely the breadwinners. You start breadwinning at the young adult, but you're definitely now officially the breadwinner. You're the baby mama, you the baby daddy, you the husband, you're the wife, you're and stuff. You're those type of people and stuff like that. And their biggest deal is heart attacks, or what we said, MI, or myocardial infarction, which is MI, or heart attack and stuff. So that's one. And then strokes. They're susceptible to strokes and stuff, and that's when the blood doesn't reach the right part of the body, the brain and stuff like that, and so it's cut off, and so that part of your brain dies until they find a way to get that blood flowing back in there, and everything. So that's a problem because it does stuff depending on what side it hits and all of that stuff. So That's a whole nother podcast, but I'm just saying it's dangerous and stuff. And then there's diabetic emergencies, because this is when you really faith around and find out that you have type 2 diabetes. Oh, I'm pre-diabetic. I ain't even diabetic like them other people and stuff that be doing that and stuff. I'm pre-diabetic. My A1G and all of that is like a 8 or 9 and stuff. I'm still pre-diabetic though. That's what they told me 2 years ago and stuff, that I was pre-diabetic. Yeah, you diabetic. you diabetic. Okay. But anyway, and stuff. So diabetic emergencies, hyperglycemia. It's called diabetic ketoacidosis. Don't worry about that, DKA. But that means your blood sugar is way too high. You're going into a coma unless you get that fixed. But guess what it do? Your body actually snitch and tell on you. It's gonna make you dizzy. It's gonna make you lightheaded. It's gonna make you misstep and off balance. It's gonna you might start sweating. You might get salty mouth. Your eyes get blurry. Like it's like, hey, oh okay, you gonna let it go up 100 more, huh? Oh, now it went from 300 to 400. Okay. Oh, you still ain't gonna tell on it? Okay, 500. I'm gonna put you to sleep. Let's see what happens when you go to sleep and don't wake up. I'm gonna put you in a coma. But guess what? It could be hypoglycemia, which is your blood sugar sunk too low. And then it say, hey, you start sweating, salty mouth, nauseated, and all of that. Hey, oh, you still ain't gonna pay attention to it? Okay, I'm gonna drop it some more. Okay, 50 ain't enough for you? I'll drop it down to 49, 48, 47. Yeah, you're gonna go to sleep and not wake up. So either way, don't play with diabetes. That's the whole point. I don't care what your hemoglobin, A1Cs or whatever and stuff like that. We'll talk about it again. But right now, for crisis sake, it's a problem. It's a problem. So that's our middle age and stuff. And then they have stress related illnesses like panic attacks, like too much being put on them and stuff. And then they just break. They can't cope. They ineffectively cope. They're not able to properly cope for the situation. So they break down. It comes out in anger. It comes out in ready to fight and stuff. And stuff. It comes out in a lot of stuff. I remember when I was stressed out enough, I'll just say I had enough and stuff. Yeah, I was like, I hate the walls. I can't even be thankful for my job because I hate coming into this bad boy. I hate the sight of the beautiful lobby because where I'm going, it's a nightmare on Elm Street where I'm about to go, where everything I do is wrong and everything I do is right is wrong, and everything that I don't even have to be there and I'm still wrong, and stuff. Yeah, and stuff. I mean, sometime I was right. I guess I got 21 years in and stuff. So somehow they figured out that I ain't wrong about everything, but I had to work a little bit harder. I'll tell you that much. And it made me very resentful. That's why I'm doing a podcast and I'm an entrepreneur. Okay, but anyway, older adults, 65 plus. The things that they have to worry about, and stuff. That's 65 plus. That's somebody's grandpa, somebody's grandma and stuff. Actually, I'm a grandmother and stuff, but I'm only, under 21 and stuff. But I'm a grandparent and stuff. So definitely this hits my heartstrings also, but it also hits my mother, who is a great grandmother and a grandmother and everything. Welcome on in, Auntie Josie. Thank you. She said, good evening, everyone. Yes. And stuff. I'm talking about how to cope with an acute or sudden health crisis. And it could be anything, stroke, heart attack, infections, you name it and stuff. It has something to do with all of them and everything. So I'm talking about 60, well, not 65, but 66 plus. which is usually grandma and grandpa ages and stuff like that. And that would be falls. I've fallen and I can't get up. You know, that's really a thing. That's really actually a thing. Thank you, Sandra. She said, teach Nurse Charlene. Special shout out to nephew Michael. Oh, thank you. Shout out Michael J. That's my son, my oldest, and everything. Yes. Who made me a grandmother of two beautiful, oh my God, baby boys and stuff. They're twins. They said that they're not identical, but they look identical because half the time I can't tell them apart. They just start looking like each other. They have the same facial expressions. They actually are synchronized. It's weird, but oh my God. But anyway, getting back to the subject. Yeah, shout out to my babies, Keanu and Cairo. Okay, so getting back to stroke, you know, and stuff. When you're older, you slow down, so you're not taking them long walks or even jogging or something like that, and doing those serious exercise and stuff. You start slowing down. I'm grandpa, I'm pawpaw now, you know, or something like that. But no, pawpaws and grandpas and grandmas and meemaws or whatever they call them, grandmas and stuff like that. Yep, you still need to exercise. You still need to exercise because you'll mess around and find out that you could be susceptible for a stroke. And guess where they like to come? In one of your legs, in the back behind your knee. And they be like, yep, I'm stopping all this traffic. And I'm going to get in here and I'm going to be as important as possible. That means that whatever blood that was supposed to reach up and go to this place or that place, I'm going to just sit here. And when I get big enough, I'm going to float up there and I'm going to stop something from happening in the brain. I'm gonna cut off the blood supply because I'm going to be big and fat now and stuff. By the time I came from their leg all the way up and broke a loose and came on up, and then they ain't eating right and all of that stuff. So I'm going to turn into a nice little ball and I'm going to stop all the traffic. See how they like that. Yeah, you all die, including the little blood clot. It died too, you know, and stuff. So yeah, it ain't helping and stuff, but that's where that comes from. And then it's heart failure. So a lot of people sleep on this, but it says it in the word heart and failure. That means it's failing to do what a heart's supposed to do. It's failing to, if your heart's supposed to go boom, boom, and it's gone boom, boom, yes, boom, boop, boop, instead of boom, 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 and it's going boop. Oh, you thought that was a heartbeat? Boop. Yeah, that's a problem. I'm just saying. That's called heart failure. It's failing to do its job of properly beating, or it's overloaded. So it's a whole bunch of things that can cause it to do that. But after a while, I get mad and be like, boom. Okay. Yeah, that's a problem. Okay. So then also 66 and plus and stuff is, susceptible to infections like urinary tract. You might not be, I'm sick of this. I got all these medicines that I take. They make me pee all night and all day and stuff. I don't feel like taking all of these medicines and stuff. And then you don't take them and your body can't clear the toxins out your blood that makes the thing called pee and stuff. So then it turns into a urinary tract infection. Welcome on in, Michelle. Thank you for coming on. Welcome on in, my brother Jason. Shout out to the Belizeans. He said, teach sis. All right. And stuff. So going back to this infections. So this is the 66 plus and everything. So one is a UTI. Another one is pneumonia. Because you're not up walking around and speeding around and stuff. Well, some of us, because we work past, 65, they be 69. I got an auntie that's 69 and 29 and she's out there driving them buses and it'd be a hot mess. But she get up and go to work, and stuff. So the whole moral of that story is, if you're not moving it, you're going to lose it. And then another thing that you're susceptible for at 66 on up and stuff, is senior status, ish, and everything and stuff, is the fact that you could get sepsis. That's your body's overwhelming. That's when the infection is overwhelming your body. It's a blood infection. And where's the blood at? Inside you. So if it's got a hot mess going on in there, guess what it do? It touch everything it's not supposed to, leave a little residue, jack you up. You got fevers going on. You go into delirium, and you might not make it. The doctors is running and racing, putting up 17,000 IVs and all of that stuff, and giving you all this medicine and stuff like that, trying to help you, and stuff. And it still don't be seeming like it worked right away, and stuff. And then next thing you know, you on some type of ventilator or something like that and stuff, because it could get that bad. It's a medical emergency. It's a sudden health crisis. It's a problem. Okay. All right. So then these are signs and symptoms, just in case you didn't get it clear from what I just explained to you, by age group and by situation and everything and stuff. Signs and symptoms, or when your body is snitching, when to act fast. Your body is telling you something. These are things that you need to call 911. Go to the emergency room if you see this. Chest pain or pressure. Did you have it yesterday or the day before that or the day before that? So it just showed up today. Well, go tell on it. It might crush something, so you never know. Why is it pressure? Because something ain't acting right in there. So you got to tell on it. It told on you by feeling like chest pain or pressure and stuff. That's a problem. That indicates a possible heart attack, but it also can indicate a maybe stroke and everything. So then you got sudden confusion or slurred speech. It ain't always because you're drunk. You could be having a stroke. Just period. Did you drink something? Well, it could be that. But what if it's just a stroke? You've been under pressure and stuff, and then you finally calm down, and then all of a sudden your face, it start doing stuff. That's a problem. If you don't go, you will know and stuff. If you make it and stuff. Then you got trouble breathing. The ABCs of CPR is airway, breathing, and circulation. Airway being first. If you don't breathe, you won't leave. No, you won't live. And stuff. So if you don't breathe, you're unalive. Just as simple as that. You can't get air in and pull air in and out and stuff like that. You will pass away. That's 911 worthy. Because they're going to put some oxygen on you and try to help you out and stuff. But if you don't tell that, that's all right. I got a sister that's a nurse. I got a cousin that's a nurse and stuff. She'll fix me. No, I won't. Especially if you talking about me. No, the heck I won't. I can't even fix me. I'm calling 911. I ain't waiting for you. I'm calling on myself. I tell on myself, what's the number? 911. And I'm a nurse, and I will call 911 on myself. I will call it on myself and stuff. But anyway, severe bleeding. You didn't cut that damn finger. You didn't cut your finger off or cut it, real good where it sting and all of that. And it started having a heartbeat in it. That's a problem. And then it won't stop bleeding. You better apply pressure and call 911. You got a problem. Because if it keep on bleeding and bleeding and bleeding, after a while, you're going to lose something. You didn't get a transfusion, did you? Okay, then you lost a lot of blood, and stuff. It's a problem. But it's not just that severe bleeding. It could be from anything, a car accident, the windshield breaks and cuts you or something like that. It's a problem. So it's not just that. I just use that as an excuse because that's the most simplest thing you could do because I didn't cut myself about 170,000 times. That's why I feel like I should never have to cook. I need a personal chef to do it so I don't have to ever cut myself again in my life. But anyway, while that's happening for me and stuff, I'll just go ahead and call a popos 911s and tell them that I cut myself and stuff, and on accident, not because I had a plan and stuff. So then also sudden weakness on one side. If y'all don't know, that's possibly a stroke. It's about a 99.999% chance that's probably a stroke, at least a stroke first and everything and stuff. So, I'm just saying things to make you say, okay. Then you got high fever with confusion. And that could be from an infection in your body. That's when it's overwhelming your body. So sepsis is one of those things where it starts with, the fever, and then you might get out your mind, hallucinate even and stuff. That's where the confusion, you don't even know really your name or your date of birth or something like that and stuff. Yeah, that means it's a problem. It's sudden though and stuff. So that means it was building up and it was telling, and you weren't paying attention, so it did something else. Oh, you're not paying attention still? Well, you about to find out today. That's the body don't play. You'll find out today. Okay, and then we got suicidal statements or behaviors. That's why I'm gonna kill myself. I hate everybody. I'm gonna kill myself. Do you got a plan? Let me know, because people succeed when they got a plan. So you got a plan yet? Let me know when you get a plan. But I'm gonna call 911 on you. I'm gonna tell on you anyway, because you ain't got no business just blasting that out in the air, in the atmosphere. The devil gonna catch it, and then he gonna be like, "I got something for you. I'll tell you exactly what to do, and you could go ahead and end it. I don't need you anyway. I got a whole bunch of little devilish people. I don't even need you, and stuff. And you be talking to Jesus anyway too much and stuff, and he'll help you out. I'm just saying." And so the moral of this story, which is signs and symptoms of when to call 911, is time saves lives. Don't wait. I got it. Pepto-Bismol. They never said Pepto-Bismol or Tylenol or Motrin, Aleve, or what else? Percocet, marijuana. They never said that all you have to do is take that without finding out why did it do what it did to make you feel like you got a problem, and stuff like that. So tell, snitch, 911. Okay. So treatment, what usually happens, if you're in a healthcare health crisis. So you're having that stroke, you're having that heart attack, you have sepsis, from something or another and stuff. You almost succeeded in killing yourself, and all these things, mental health crisis and all that stuff. We said all of that to say the immediate care. This is what happens. The emergency evaluation. That's when you go 911 and they roll you in the ambulance or somebody drop you off at the hospital. He been shot. Get him. Or whatever, Oh, okay. We found out he got a hole in him and he bleeding all over the place. So we know that that's a problem and everything and stuff. So the moral of the story is the first thing they do is they get you, bring you in the back and stuff. They're evaluating you. So that they start with that triage sometimes. And that's where they get your blood pressure and all of that stuff and run that all down to the doctor and everything. So the doctor is already plotting on you from what they found out from the nurse. So the nurse is asking you questions. They not nosy. They don't really care. Their job is to triage you, to find out what's wrong. You got a pain down there. You got a pain up there. You got a pain here. What's happening? So then the doctor is going into it and stuff. The doctor is behind the scenes looking at everything that's put in before they come in. So they already know a little bit about you and everything, whatever it is and stuff. Oh, you work at so-and-so, and that's why they can tell you your resume almost. You work at such and such and stuff. You a nurse and you didn't act it up like this or whatever it might be. It don't matter and stuff. is what it is. But that's how they're smart. So they got a little a wheel of things they got. If it's this, then we do this, this, and this. If it's that, that, and that, and stuff. So it makes them look like they super smart, and they are, and stuff. They didn't have a lot of schooling and stuff, but the whole point is somebody already had it before you. So they did this, this, and this, and it had a good outcome. So that's what they're gonna do for you, and so on and so on and so forth. So then immediate care, a evaluation. That's when they check you out and everything. Then they do imaging. That's your CT scan, your X-ray, your MRIs, and stuff like that. They pick it according to what you came in for and everything. If you have extra once you get there, because you didn't tell on that other stuff that led up to it and stuff, then that's when you might get all of them and stuff. Then they got blood tests. Yep, that's why they take the blood from you. They take about 3, 4, 500 tubes. One of them, if you come in and you ain't supposed to really look like you supposed to be there and stuff, yep, they doing a tox screen. What drug, what meth is they on, what crack is they on, or whatever and stuff like that. That's where that comes from and everything. So that tox screen, they trying to find out marijuana, methamphetamines, opioids, mollies, whatever, ecstasy, whatever, mushrooms, LSD, whatever. I don't know. I'm just saying stuff. But anyway, they do all of that. And then they got IV medication. If it's this, then we give this, this, and this. If it's that, we give this, this, and this. If it's pneumonia, we give an antibiotic. If it's bacterial, we give this antibiotic. If it's viral, we give fluids, and stuff, and so on and so forth. So they got that all jazzed up. They got a whole little template and stuff. Then last but not least, you come in, you're not breathing. I told you not breathing means you're going to be unalive really soon of not breathing and everything and stuff. So you may go on oxygen at first because you're just having trouble breathing. But when it go down to where you don't look like you even holding up a breath and stuff, that's when they might put you on life support, and stuff. And they put a tube down and breathe for you until they find out what they can do. And if they can't fix you, hey, I'm just saying. And then they go from immediate care, and that was that. Emergency evaluation, imaging, which is your X-rays, MRIs, and all of that stuff. Then they go to blood tests, they go to IV medication, they go to oxygen or a breathing tube or something like that. Then they go to stabilize you, to keep you at bay, the best they can. Then they do that. They treat the cause. What is it? Do I need antibiotics? Do I need pain medicine? Do I need this? Do I need that? What is it? And stuff. Do I need a steroid? Do I need whatever it is? Then they and that's how they get you where you're stable, what they call stable and stuff. Then that's it also prevents complications, because if they don't get to this in time, then maybe another thing pops up that puts you at risk for losing your life, and then another thing piles on top of that. So they're trying to prevent all those other complications by giving you certain things to stable you out, to mellow you out. And then pain control, because pain can cause a whole bunch of other things, like the blood pressure to shoot up or something like that. So that's a problem and stuff. So then they do that. And then there's emotional support. That means that they might get somebody in to talk to you and stuff, or see if they could, after the visit is over, just in case it's hospitalization or something like that. And they might want you to talk to a therapist. It depends on what's happening. Uh-oh. Can anybody else hear me, or did everything cut off? Just checking, you guys and stuff. Can somebody, if they can hear me or not? Because I was on the roll and stuff. Just let me know. You can hear me? Oh, okay. It might be, check your phone, Miss Sandra and stuff. You said you are having technical difficulties, or maybe it's your end. I just asked my mother who's on, and she said I'm on. So just in case, just check it out. Okay, Mary, Nurse Mary said yes. Thank you, sis. It's okay, Sandra. Just maybe turning up the volume or something like that and stuff. We'll see. I could hear you, but it keep cutting off. Oh, this AT&T, y'all. Don't get AT&T. No, I'm just. It's AT&T. It's supposed to be fiber optics and stuff. It's supposed to be fancy smancy. Okay. It was pausing, but okay now. Okay. So it could be me wiggling around and stuff, or I'm talking too fast and stuff, but we'll see and stuff. Thank you guys. I appreciate you. That's my other nurses out there getting on down and stuff. So that was the stabilization. So it's immediate care, stabilization, and then the recovery phase. And that will be rehab or rehabilitation, or they call it rehab. And that's usually this thing called a sniff. They don't want to call it a sniff, but it's called a skilled nursing facility. And it usually have our elderly that have dementia and stuff like that, but it has a little spot where you could get some physical therapy and all of that stuff. And most people say H to the no and stuff. We're not doing it and stuff. Some people do go because they have to. Okay. Thank you. Auntie Barbara said it's okay now. Thank you and stuff. I just got to stop wiggling so much. I probably didn't jacked up the little microphone or something stuff. But that's the rehab part of it. And then that's where you go and do physical therapy every day and stuff for maybe a couple weeks to a month or something like that. And you might be there and stuff. And they just try to get you back on your feet so that when you go home, it's not so much trouble, and stuff on you. It's not so much for your family to deal with and stress out about and stuff. And you can get up and move and do some things yourself also. And it keeps you from feeling like you a burden on everybody and stuff. So that's what that rehab is supposed to be for. And it is actually good for you because they move you around and they make sure you get up and go and walk and walk and walk, and stuff like that, depending on what happened and everything. So it is an actual good place to go, just as long as they send you to one that's not unreasonably rough and stuff, and you'll know it and stuff. So anybody that might be going to rehab anytime soon and stuff, just let me know which options they gave you so that I can look them up and let you know, don't go there and stuff. I'm gonna tell you. But anyway, it's also medications. These medications are strictly for the situation. So if it's something like a broken leg or something like that, then you might get some Norco, you might get some oxycodone or oxycontin and stuff like that. Do not take it after you're better, after you recover, because then there's a problem with that. There's an actual problem with that. And that problem would be getting addicted or hooked to the medicine. And that's a problem because now you went out the hospital, recover from one thing, and now you back at the hospital because you got an addiction to the pain medicine. You want some more and you want some more. Now you can't live without it. Now that's all you think about. Yeah, that's where addiction comes in. And so why are acute health crises so hard to cope with? The number one reason why nobody want to call 911 or nobody want to really deal with it and stuff is because they fear death or permanent disability. Oh, you got that? And then they got a problem with it or something like that. Or I didn't know you had that. Like, how did you get that? See, I told you if y'all was doing this and doing that, and this, yeah, it's not time for that. Let's work on how to fix it. Okay? So this is why they're hard to cope with. Or that's dad and he make all the money. And now he didn't threw his back out or something like that, and he got to go to rehab and all of that stuff. How are we gonna get our money? I need my money. I need somebody to pay my car note, pay my rent or whatever and stuff. We need food on the table. What we gonna do? You see what I'm saying? You depending on that one person. I'm just saying it don't have to be that. I'm just saying that it's really that serious though, and everything. So the fear of death or permanent disability, meaning that he can't go back to work or she can't go back to work, and they got paid and stuff. Now they can't go back to work, and stuff like that. So where the breadwinner money coming from? And then also the problem is loss of control. Now you gotta depend on them to give you the right stuff to keep you alive. So you can't control it. You can't Tylenol it. You can't Pepto Bismol it, or something like that and everything. And so Auntie said it's okay now. I think I did read that. But anyway, just in case. And then what else? Financial stress. Yeah, if they don't go to work, where's our money gonna come from? That's a problem. And then trying to go, the what is it, disability or something, trying to get that money and stuff. It take forever in a day, and then it'd be a hot mess. And if you ain't got that cushion that I talked about on It's My Resolution and I'm sticking to it and stuff, that's gonna be a problem. And then the role changes in the family. Say the mother was the breadwinner and stuff, and now the father got to get out and be the breadwinner and do it all, or vice versa. The father was the breadwinner and everything and stuff. Now the mother got to take care of the kids and and do it all, or so vice versa. Or the mother ran the whole show and stuff, and now that she's not in it all the way and stuff like that because she can't and stuff, then somebody else has to pick up the slack to keep things going and stuff. So this is serious, life-threatening things that we go through and stuff when there's a healthcare crisis. The emotional shock and confusion. Why I gotta get it? Why me? What? We don't even have that in our family and stuff. I'm healthy and stuff. I don't know why I be eating all my vegetables, like 800 carrots and stuff a day and stuff. Why they picking on me? Why I gotta have it? I think your test is wrong. You should retest because I ain't got it. I don't have that, or whatever it is. How you you looking in there, huh? You've been ignoring some signs. Go rewind your life and find out if you stop talking about this or that or something like that, and now you got it and stuff. That don't even run in my family. Why I gotta get it and stuff? That I don't. I'm just saying, people get mad, be mad at you, ready to beat you. I'm just a nurse. Look, you better keep your hands to yourself. Keep your hands to yourself. I do martial arts, but anyway, medical information overload. Who went through that? Bam! Medical information overload. That means I'm busy doing a podcast, dealing with a acute medical crisis right now, as I speak, looking at you right now. That's why I consider myself an expert, because I had the faith around and find out and stuff. So the whole moral of that story is, while I'm going through it, I'm getting all these different things and stuff. And then guess who's overwhelmed? My mother that's going through with it. And guess what? I love her so much. I take all the brunt, all the smart mouths, I want to speak to your mother. Y'all know her name. But anyway, I want to speak to your mother and stuff like that. And I'm like, yep. And she don't want to speak to y'all. So speak to me or click. You'll find out sooner or later if you don't speak to the right one. But also, guess what? I'm a nurse and I get overwhelmed at how much information they give me. And sometimes I'm glad that I didn't know all the things that I needed to, that was going to happen, because I probably would have just passed out of exhaustion. It's a lot. It's a lot to go through all that stuff. And acute means suddenly medical crisis. So the whole moral of that story is I'm trying to say is, yeah, it's okay. You're not going crazy if you feel overwhelmed, if you feel like it's just too much to deal with and everything and stuff. Don't run away from it and stuff. Embrace it and just take a little bit at a time. You're going to have to explain that over. Yeah, I only could take so much, and then we got to come back another time and you could give me some more or something like that. But you got to figure it out. But guess what I did do? Um, because it's mommy and it hits different, what I did is I finally gave myself time to breathe so that I could come back and take in more information, and then breathe and come back and take in more information. And then at the same time, and stuff, while they're explaining all of this stuff and on a video visit, and my mother like, could I go lay down? I don't want to deal with this or something like that. I had to say, Mom, no, you got to stay right here, because they don't want to talk to just me. They want to talk to the person that's going to get this medicine or this treatment or this so and so or this blah blah blah, and stuff like that. So I had to sit there with her and say, yep, you got to sit here with me, Mom. It's okay. I'll take in the information and the notes and everything, and you just sit here and stuff, because the more you hear it, then you don't be left with, I thought they was going to say I didn't have that, or and stuff like that. Then you become stronger and you become, weaponized. Now you become a leader, and then people can know your story. I can't wait to start my testimonial Tuesdays, where I'm gonna have real people that went through some real stuff, real stuff, come on here and show you what they working with and stuff. And it's coming. Yes, Barbara, it's coming. She said good and stuff. So the coping skills needed for a patient, and I'll be off in about 10 minutes and stuff, y'all, because I got to get this out and stuff. It's very important, because this is what you need. If you have to go and stuff, just come back and at least watch the live for me and stuff. But yes, so coping skills needed during a healthcare crisis for the patient. You got to be able to accept as a patient, it's happening to you. Okay, we over that. It's happening to you. There ain't no way around it. Accept the help, whatever it is and stuff. Accept it, and that's from the doctors and their opinions and what they want to do and their treatment modalities or whatever and stuff like that. Accept it. Then you got to focus on one step at a time. Let me get through this, and then we'll worry about that other when we get there. But let me get through this first. Let me breathe, and then now I go to the next step and the next step, and stuff, because you might have to go through 3, 4, 5, 6, 7, 8, 9 steps, before you get to the good part. But at least you're trying, and you told. Some people just die. Okay, and stuff. Make sure you're asking questions. If you don't know, ask, what is you doing to me? Do that hurt? That's a logical question. They need to let you know, do it hurt? Yeah, do hurt a little bit, and stuff. I know you was going to ask me that. Do it hurt? Do I get sick? Do I do this? Do I do that? Do I got to do jumping jacks? Ask. And then don't be afraid to rest without guilt, to build up your strength. You do need to rest. Not rest in peace, but rest and stuff, and get your strength, gather your strength, and stuff. Rest, hydrate. Exercise when you can, even a little bit, and stuff like that. But whatever you do, it's towards making a better you, because there's only one you. And then after you're gone, there's no more you, just your memory of you and people's memory of you and stuff. So then for the family and the caregivers, stay calm and grounded. Ain't no blame game or nothing like that and stuff. It's stay calm. Participate where you can and stuff, and keep it loyal and everything, first of all. Then second of all, the main caregiver or whoever that person is with, whether it's the husband or the wife or something like that, taking care of this particular person and stuff like that, they need to figure out how to assign roles. Now, me as a nurse, because that's what I had to do, it's called delegation, where you delegate. I need the nurse to come in here at 11 o'clock, and we're going to turn the patient. We're going to change the patient, and, and so on and so forth and stuff. That's, you delegate. You give it to my brother. I got to give this to my sister. She's good at this and stuff. She's the best cook. So I'm going to give her this. I'm going to give my brother this. He's the best lifter and stuff. So he'll help me with the lifting and this and that and stuff, and so on and so forth. Okay, if you can understand that and stuff. So then that's also when you're assigning roles, who makes the calls, because the person that's actually taking care of the patient, they probably can't talk to you. So it's not about you and stuff. It's not about me. If I call, like, why y'all didn't tell me this and that? No, that ain't how it go. What if they busy? Is you gonna come do what they doing? Then no, you can't get mad and go off on somebody because they didn't answer your call and stuff like that and stuff. You gotta wait your turn. Wait your turn. Calm down, watch your mouth and stuff, because if they're taking care of them and stuff, they might not be able to get to that phone and that, spot of the moment and stuff like that. You got to think about what they might be doing if they're not answering you, if none of the phone calls are answered. But and stuff, that's why you got to delegate who calls and makes the calls back, who stays and does the work, and stuff, who comes on this day, who comes on that day, who goes and picks up this, who goes and picks up that, who drops off this food, or who does this and whatever else and everything, who updates everybody else, so that you're not on there doing 150 texts or something like that and stuff. How do you do that? Because that's a whole job in itself. Oh, Auntie Barbara said, thank you, Charlene. Keep a level head. Yes, that's right and stuff. You got to stay calm and stuff. But guess who did it wrong? Yeah, I'm so proud. Yep, I did it all wrong and stuff. So that's why I'm telling you, I'm saving you guys the trouble, because I did it wrong. I did this and I did that and I tried to do it all. And guess what I came out with? High blood pressure and stressed out. Yep, I'm fine. Yeah, I wasn't fine. But I knew how to tell on myself. So guess what I did? I saved my life. And now the smile you see is because I'm okay. No, I'm really okay. The other one was fake. But you wouldn't have known the difference and stuff until I told you. But yes, I wasn't fine. Okay. So that's that part. And then also accept the outside help. Accept that friend that's gonna cook that meal and stuff, that hot meal and stuff, and bring it to you, stuff. Accept that, somebody will go to the grocery store and bring you a few things that you need, odds and ends or something like that. Accept that person that wants to come over and sit with the person, and stuff, and play cards with them and keep their mind off of their situation and stuff, and do things like that, do sweet things and stuff like that. Accept it. But also, as the caregiver, okay, and stuff, use the emotional coping tools that they give you, like this, and it actually worked. At first I was like, I ain't doing that. No. And stuff, but deep breathing, that it got the nerves to work. I ain't doing that and stuff. Okay, now this one I will and stuff, and that's pray and meditate. They said 90 seconds of deep breathing and eyes closed, and just take it quiet, still away and stuff, and that resets you, so that you could take whatever else gets slapped in your face and everything and stuff. That's really a thing. Journaling. I haven't did it yet, but I've been told by loved ones that I need to do that and stuff. So guess what? It's my New Year's resolution and I'm sticking to it. So guess what? I'm going to start journaling. Guess who got a whole bunch of journals? Guess who didn't write in them? Thank you. I'm so proud. Okay, I didn't write in it yet. Okay, so then also talk openly about your fears. That was another thing, because I'm the nurse. I'm supposed to have it all together, huh? That's a lie. That's a lie and stuff. You're not supposed to always have it together. You're a human being. You got to sometimes faith around and find out and stuff. So that's where that comes in. And then limiting misinformation and social media overload. All y'all pray and stuff. She got all of this removed and all of this done and all of this, and she's this and that, yeah, and stuff. Clean it up and stuff. Just pray for me and my family. We're going through and stuff, something simple. Don't put their name and social security. You messing with their HIPAA, they private information and stuff like that. So um definitely limiting how much, and stuff. Yep, they had to get a pelvic something and got a couple things clipped off down there, and yeah, they don't need to know that. A lot of people can't even stand the sight of blood and stuff, so don't tell them and stuff. Just deal with it yourself, and say what you need to say. If it gets around to everybody that needs to know, they know a little bit but they don't know everything and stuff, but keep it polite and light and stuff. So then keeping a family together during a crisis is share clear, honest updates. Let them know this is what's happening now, and stuff like that, and get to that part and stuff, because you never know that one family member that might have went through it and stuff, and they could tell you some advice on how to maintain, and stuff. So sometimes it'll help you just to share. Now, I ain't telling her that, or I'm not telling him that, no, and stuff. Give a little bit, and then you get a little bit and stuff. So that's the good part about that. And then avoid blaming. If y'all was healthier and y'all ate better and stuff, and y'all didn't do this and do that and stuff, yeah, avoid blame. If that's the case, everybody did it. Everybody did it. So blame yourself. Don't even blame nobody else. Just blame yourself. I did it. And I did it. I did it. And guess what? The biggest thing is, I'm a nurse, but I can't give you a heart attack. I can't give you a stroke. I can't give you congestive heart failure. I can't give you cancer. Yeah, nobody can give nobody nothing and stuff. They got to find out on their own, everybody and everything. So just keeping that clear and everything. Also, hold regular family check-ins where you just giving everybody a little update and stuff. Sometimes they need to hear something so that they feel like, at least I checked on you, and stuff like that and everything. So that everybody feels some type of importance and stuff like that. Be nice and everything. So I'm gonna skip over that and just go to I was gonna do myths versus facts. This is one I want to do this one though. The myth: strong people don't panic. The fact is, panic is a normal response to a crisis. So that's not true. Strong people don't panic and stuff. That's yeah. I'm okay. Now I'm on blood pressure medicine. Ain't that nice? Okay. And stuff. But anyway, I know how to take myself off when it's time and everything. So I'm good. But everybody ain't gonna know that and stuff and how to do that. But anyway, talking about fears makes things worse. That's a lie and stuff. The fact is, talking reduces the anxiety and the isolation that why me, why I got it and stuff. If you talk about it to other people, you never know what they might know or who they might know that been through the same exact thing with the same exact diagnosis and the same exact situation and stuff like that. So that's where that comes in at. If they look okay, they're fine. They look okay. You look okay. I don't even know how you got blood pressure medicine. You look like you fine and stuff. Yeah, but I wasn't. I was lying. Smiling faces lie and stuff. But anyway, they look fine. If they look okay, they're fine. Many serious conditions are invisible. You can't see if your blood pressure up. You can't see if you going into diabetic ketoacidosis and about to go into a coma from a high blood sugar, and stuff. You can't see it. You can feel it. You can't necessarily see it. And stuff. It can look like anything. Even a stroke doesn't hurt. It just come on and get you and stuff. I have to do everything myself. That's the myth. The fact is, asking for help improves outcomes. It actually improves the outcome. And this is a fact. Healing takes time, physically and emotionally. That's what you need to know. It takes time to heal. And so my final thought, Yes, my final thought, or take home message. And then I'm done, you guys, and this will take me about a minute. Acute, which is sudden health crises, are overwhelming but survivable. So remember that. They are survivable. It's not just the end until it is the end and stuff. So acute health crises are overwhelming but survivable. Early action saves lives. Early action. Don't put it off if you know in your gut that it's a problem. Even if you know on your family member. And guess what? Kids go through crisis too, health crises, and they can die. So it doesn't matter just because they're young. They're not supposed to die. They're young. No, they can go too. Everybody can get it. They're humans and stuff. So that early action saves lives. Coping is a team effort. That means everybody got to be all in. Everybody got to put their hand in. It takes a village, literally, to get somebody's life together and stuff so that they can live and you won't be at their funeral if you can help it. I can't say it always happens every time perfectly, but it should, and stuff if you do the right things and stuff. Families heal best through communication. So I got to talk to you. I got to tell you what's going on and stuff, but I can't tell you every single last detail down to the nugget and stuff. It'll overwhelm you and you mess around and be on blood pressure medicine too if you're not already, and stuff. So giving you good advice, keeping you updated and everything and what's new, what's happening now, and stuff like that should suffice and everything. And so then recovery is not linear. And that's okay. It's not just a straight line and then I'm in recovery. No, it takes some time and some steps and a little bit of recovery and everything in between treatments and stuff like that. But you do get to the finish line. It's just not straight boom, you there and stuff. It's boom, and then you wait. Then you go around this obstacle and you might go around this one. You might go around this one and then you get there. So it's not just straight ahead. Yes. Auntie Barbara said caretakers have to take care of themselves also. Very important. Absolutely 100% important. You got to take care of yourself. So if I would have told on myself, guess what I could have set myself up for? An acute health crisis like a heart attack. My blood pressure shot up and wouldn't go down and stuff, but I was saying I was okay and stuff. So the moral of that story is if I wouldn't have known to snitch on myself, my body was snitching on me. So I had to snitch on it. And so therefore, that's how I made it through. So the things that I started off with, let's say 5 months ago, I'm not at that place anymore. I'm at a place of healing and getting it together. So you do have to take care of yourself. Even if you are a nurse, even if you are healthcare something or another, and some medical terminology and stuff. Even if you're a doctor or a nurse practitioner, and stuff, you got to take care of you. Because you can get it too, just like anybody else, like your patients and everything. So then you are not weak for needing help. Guess what? I'm a nurse. I shouldn't be asking nobody for nothing. I could do it. I know how to go to Walmart or Food Co. and stuff and get, yeah. What if you don't have time because you got 500 appointments and stuff? They just lined up and stuff, one after another, like you in the Twilight Zone. Because I was in the Twilight Zone for a while and stuff like that. And so not asking for help was the biggest mistake of my life. But I know how to do it now. I just make sure that just like when you pray, you want to be specific because God want to know what you know. He wants you to tell him what you think he might know because God know everything already. He already know your whole book. But are you going to say it right and stuff? So when you're dealing with this and everything and stuff, are you going to act right? It don't matter if you're a nurse and stuff. And it don't matter if you're a great cook, or something like that. It doesn't matter and stuff. If you don't have the time, you don't have the time. So accept that food, accept those cleaning products, accept that help Except that I'll hold her hand while you go do this and get you a nap. Except. It's very important. So right, Auntie Barbara, that is very important. And you're not weak for needing help. You are a human being. So that's the biggest thing. Final thought. In a crisis, the body needs treatment, but the heart and mind need understanding. That's a big one. I wanted to read that one more time. In a crisis, the body needs treatment, but the heart and mind need understanding. You need to be understood. Like, you see what I'm going through, and stuff. And guess what? Some people be like, yep, because I went through the same exact thing, and stuff. Different people, but the same exact thing. So yes, I do understand. That's how I felt too when I was going through it, and stuff. This is the person saying that's how I felt when I was going through it. Like, did anybody understand? I feel trapped. I feel overwhelmed. All these doctors is calling, all these automated so-and-sos and stuff like that. This one going, I gotta do this, I gotta do this, I gotta do that. Yeah, and stuff, and everything. And yes, it can be very overwhelming. But remember, you're not weak, you're human. So you got to take it one step at a time. One step at a time, you guys. Thank you guys for staying a little bit extra with me. I usually only go about an hour and 15 minutes. I went an hour and 30 minutes, almost 40 minutes and stuff. But I appreciate you guys. I thank you for carving this time out your busy schedules and stuff of all this stuff that's happening and everything. And just remember, you are important. Your loved ones are important. And if they was in crisis, you gotta be able to jump right in. But if I gave you a couple things, like I did everything wrong, not everything wrong, but I did a few things wrong, and then I faithed around and found out, because I want to say the other F word, but faithed around and found out, and so I'm getting to the good part, and stuff. I'm getting to the part where it was a point where I stopped eating. I stopped taking care of myself, and everything. That means I was failing. So that means I was going to fail my loved one, that I was taking care of and stuff like that. So this is important. This is real lifing and stuff. So when I'm saying this and stuff, my heart goes out to you and stuff. And I hope you don't have to see anything like that soon. Or even if you are embarking on that journey of having a health crisis, and stuff, upcoming procedures and all of that type of stuff. Just remember, you are human. You have the right to be sad, a little bit depressed, a little bit anxiety or overwhelmed a little bit. You have the right to be wondering and stuff, but you gotta push forward one step at a time. Get that medicine together. You know who I'm talking about. But get that medicine together. Get them appointments together. Get that blood work done. Get this. Get that. And always tell. Your body is always snitching. All of us can take heed from this. Your body is always telling on you and stuff. You got to take care of it because it's only one you. Once you're gone, we only left with memories. We don't get to hug you. We don't get to touch you. You're only left with my memory and stuff. We don't get to hug no more. We don't get to talk. We don't get to touch each other and stuff like that. This is important. So at the end of the day, I'm not on here trying to be all sparkly and pretty. I hope y'all enjoyed that too. But I'm on here giving you real life facts and real live news as I get it. And stuff. And that's what I'm trying to do. I'm trying to change the game of all of this. Let's stop playing these medical games. Oh, if you do this, you could take some sea moss and 3 pills and a Vicodin and you should be fine. Yeah, no. And stuff. This is serious business. Behind me, 911, ambulance, wheelchairs and stuff. I don't feel right. I'm dizzy. I got blurred vision. I can't eat. I can't sleep. They're problems. That's your body snitching. It's something else going on. So when you can't sleep or something like that, it's something else going on. You got to find out. You got to tell on it. Okay, you guys, I done took enough of y'all time and stuff. I appreciate you. I'm going to read the last of these comments. Auntie Barbara said, "Thank you, Charlene. Very good information, and take care of yourself, caretaker. If you go down, what is going to happen to your patient? So be careful and take care of yourself too. You're absolutely right. I got to take care of myself also." And then Auntie Josie said, "Thank you for the good information. Good night, everyone." Good night, everyone, from Auntie Josie. And then okay. Okay. Let me see if it'll uh-oh. Let me see. Okay, I'm sorry, y'all. And so, oh, Auntie Josie said, "Thanks for the good information." My nurse sis, Mary said, "Love the sparkling hat." Oh, thank you. And she said, "Thank you," and stuff. I appreciate you. Thank you for coming on. And my mother said, "Good teaching. Can't wait for next week. God bless you always. Much love, mommy." Yes, I love you too, mommy. And Mary said, love you too, Mary. Thank you so much. Thank you all and stuff. When I get on here, I'm trying to bring y'all the best of the best. I try to joke a little bit and stuff like that, but it's serious, and everything and stuff, because I want y'all to live, as long as you can and stuff, and have a good quality of life. And that's why I bring up these things, because it's happening to all of us. All of us. Yes. Well, y'all take care, and thank you so much for everything. And I look forward to seeing you guys. The next time will be it looks like January 20th. That because I come on every Tuesday. All right, y'all. Anybody came in late or something, catch the replay. I got you. I got you. And take care. Look for your comments to be addressed after the live and stuff. I'll go on. All right. Good night, Miss Mary. Okay, take care.